Let's look at the issue of a dash roll. This module is going to show you how to safely carry out a dash roll. Now the objective is to displace the dashboard in order to aid extrication or gain access to the feet at the dashboard. Now the technique of pulling the steering wheel with a spreader and pulling chains is no longer advised. The forces on the steering column may cause breaking of the joints, thus injuring rescuers and patients. Now, dashboard reinforcement in newer vehicles may require the use of a ram on each side of the vehicle. Extend both rams simultaneously to counter the effect of downward displacement caused by this rigid construction. Now, let's go through the procedure. Firstly, you must stabilise the vehicle as previously covered. Then we add additional stabilisation directly below the B-pillar where the base of the ram will be placed. Now you should position the ram and secure it in place using a small amount of pressure. This will prevent the dash from dropping due to the relief cut. Now be sure to position the control handle outwards and not upwards so that you can actually use it. So make sure you do that. Make sure you can actually use it. Then you make a relief cut through the base of the A-pillar. Now if space is limited, it may be possible, it may be necessary to make this cut before positioning the ram. So consider making the cut on the A-post before positioning the ram. Now controlled ram extensions should be carried out, and be extremely careful at this stage and be careful to monitor all the purchase points during this operation to make sure nothing comes loose. Remember to check the stabilisation throughout the procedure, making any required adjustments as you do it. Now use your wedge blocks in the opening of the relief cut, as you can see here. Done. Now this video is going to show you this procedure in practice. So watch the actual procedure in practice on this video. Video, dashboard roll, etc. Now I want to look at footwell access, how you can gain access to the footwell. Well, first of all, if the patient's trapped, what are you going to do? Well, the first thing to do is to make relief cuts approximately 12 inches apart in the base of the A-pillar. So A-pillar, 12 inches apart, make relief cuts. Then you clamp the spreaders onto the cut section, as you can see here, and you fold this section outwards with the spreader. In some cases, it may also be possible to pull pedals away from the patient's feet using a strap to bend the pedals to one side to gain access, as you can see here, and the door could be used as a lever. As an alternative, you can cut the pedal off if you decide to do that. This video is going to show you the whole process of footwell access.